All right, buckle up everyone. We're about to take a deep dive into some serious neurology today. We're cracking open a vet neurology textbook and tackling a chapter that's all about dementia, stupor, and coma in our furry patients.
Yeah, this chapter is really a core one for vet students. It's got everything from defining those tricky terms, to actually pinpointing where a lesion might be based on symptoms. And then it even covers some emergency management techniques. It's a lot.
It's like a crash course in neurology all packed into one chapter.
Exactly.
So are we ready to break it down?
Let's do it.
All right, first things first, definitions. The chapter starts by laying out what dementia, delirium, stupor, and coma actually mean. And there's even this picture, figure 2.1, of a dog experiencing dementia.
Yeah, I think that visual is really important because it helps students understand that these aren't just words on a page, They represent different worsening levels of consciousness, and recognizing those levels is often the first clue that something is off neurologically.
So let's say you're in the clinic and a dog stumbles in, acting really strangely. You suspect it's something neurological, but where do you even begin to figure out what's going on in that brain?
Well, that's where figures 2.2 and 2.3 come in. Think of them like maps of the brain showing how different areas like the cerebrum, the diencephalon, the midbrain, pons, and medulla all correlate with certain neurological signs.
Oh, so like if a dog has dilated pupils, seems completely out of it, and has that abnormal breathing pattern, what was it called? Cheyne-Stokes respiration?
Yep, that's the one.
You could look at those figures and suspect a problem in, say, the cerebrum or the diencephalon.
Exactly. It helps you narrow things down and gives you a place to start.
That's pretty amazing.
Right.
So the chapter then goes on to highlight some of the usual suspects behind stupor and coma in dogs and cats. We're talking head trauma, hypoglycemia, hepatic encephalopathy, and that big one, meningoencephalitis.
Mm-hmm.
Should we start with head trauma? It's sadly a pretty common occurrence, right?
Unfortunately, yeah. And the chapter really drives home just how serious head trauma can be. It shows these pretty stark images of brain herniation in figures 2.6 and 2.7.
Oh, wow.
It's a visual reminder of what's happening inside that skull when pressure builds up.
Scary stuff.
Yeah.
But thankfully, the chapter also provides us with some guidance for those situations. It's Table 2.1 on emergency management of acute head injury. I mean, this is like the crash course in how to potentially save a patient's life.
Absolutely. Every vet student should have this table memorized front and back. It walks you through all the critical steps: securing the airway, providing oxygen, controlling the intracranial pressure, administering fluids. It's all there.
No pressure or anything, right? But speaking of pressure, there's another really important table in this chapter, Table 2.2. This one lays out exam findings, but like in order of how serious they are.
Right. It helps you quickly assess how critical the patient is just by looking at things like their mentation, pupil response, and breathing patterns. It's a super helpful triage tool.
Makes sense. Okay, well, moving on from trauma, the chapter actually points out that intoxication can sometimes mimic neurological disease, which I imagine can make diagnosis tricky.
Oh, it definitely can. And there are so many potential toxins out there that can cause problems. Table 2.3 lists a bunch of them, everything from over-the-counter meds to pesticides, household cleaners, even antifreeze. It's a long list.
Well, speaking of antifreeze, the chapter actually dives deeper into two specific types of intoxication, ivermectin and ethylene glycol. And I know ivermectin is often used to treat parasites, but it can be so dangerous to dogs, right? Especially certain breeds like collies.
Yeah, even small amounts of ivermectin can cause serious neurological signs in those sensitive breeds. We're talking tremors, ataxia, blindness, even coma. It's really scary.
So if you've got a collie coming in with those kinds of signs and the owner mentions they've recently given ivermectin, that's like a huge red flag.
Huge red flag.
Wow. And then there's ethylene glycol, the notorious ingredient in antifreeze. The chapter highlights these really unique crystals that form in the urine, calcium oxalate monohydrate crystals. I think they're shown in figure 2.8.
Yeah, those crystals are kind of a dead giveaway, like finding the smoking gun at a crime scene.
It's amazing how much information can be found in something as simple as urine.
It really is. Lab tests are just crucial in these cases.
Okay, well, let's shift gears a bit and talk about a condition that can be a real emergency hypoglycemia. The chapter explains how low blood sugar basically starves the brain of fuel, leading to all sorts of problems like weakness, ataxia, seizures, and even coma.
Absolutely. And without glucose, the brain can suffer permanent damage, so time is really of the essence.
So you're faced with the dog showing those signs. What's the first thing you do?
50% dextrose is your best friend in this situation.
Yeah.
IV or orally, depending on how severe the hypoglycemia is and if they can swallow safely. But you got to act fast.
Got it. Now, the chapter also throws in this curveball, an amended insulin-glucose ratio, which is shown in Table 2.6. What's the significance of that?
Well, that ratio can actually help diagnose insulinomas. These are tumors of the pancreas that produce too much insulin, which then causes dangerously low blood sugar.
Ah, so it's not just about treating the hypoglycemia, it's about finding the root cause.
Exactly. Okay, so let's move on to another complex one, hepatic encephalopathy. The chapter explains how liver dysfunction leads to a buildup of toxins in the blood. And those toxins can really mess with the brain.
And it's not just, obvious liver diseases that can cause this, right? The chapter mentions things like congenital portosystemic shunts, or PSS, which can also lead to hepatic encephalopathy.
Right. PSS basically creates a detour in the blood flow, so the blood bypasses the liver and those toxins aren't filtered out properly.
So even a seemingly unrelated condition like that can have these serious neurological consequences.
Exactly. And Table 2.7, it goes into even more detail about the various causes of hepatic encephalopathy. It's really helpful for understanding the different ways this condition can develop.
Okay, I'm starting to feel like my brain is getting a workout here. There's so much information packed into this chapter. Okay, let's see. Let's move on to meningoencephalitis, which I always struggle to pronounce.
Oh, it's a mouthful.
It is. But essentially, it's just inflammation of the brain and its coverings, right?
You got it. And this one can be tricky because it can be caused by infections like bacteria, viruses, fungi, or it can be non-infectious, like from immune-mediated diseases.
So diagnosing it must be a real challenge.
It can be. The chapter really stresses the importance of doing a CSF analysis, that's cerebrospinal fluid, to figure out what's causing the inflammation. There's even a figure 213, that shows what we call pleocytosis, which is an increased number of white blood cells in the CSF.
So you're basically looking for clues in the fluid itself.
Exactly.
Fascinating.
And of course, how you treat meningoencephalitis depends on the underlying cause. It could be corticosteroids, antibiotics, antifungals, even immunosuppressants in some cases. Table 210 outlines some of the treatment options, which is really helpful.
Okay, let's keep this Miro train rolling.
Yeah.
Next up is hydrocephalus, water on the brain. The chapter explains how this buildup of fluid in the brain can cause all sorts of problems.
Right, and it can be present at birth, what we call congenital, or it can develop later in life, often due to trauma, tumors, or infections. Figure 214 shows what hydrocephalus looks like on imaging, which helps visualize what's going on.
So you're basically seeing all this extra fluid putting pressure on the brain. And treatment often involves medications like prednisone to reduce the fluid buildup, or sometimes even surgery to implant a shunt to drain the fluid.
Exactly.
Okay, on to neoplasia, which is just a fancy word for tumors. Sadly, brain tumors can cause a whole bunch of neurological problems.
They can. They compress and disrupt the brain tissue, leading to a whole range of signs. Figure 216 actually shows what a brain tumor looks like using advanced imaging. Really highlights how important CT or MRI can be for diagnosis.
Absolutely, and the chapter even provides us with a handy table, Table 212, which lists the common types of brain tumors that vets might encounter.
Right, like meningiomas. They're one of the more common ones we see, and thankfully, they tend to have a better prognosis than some of the others.
That's good to know. All right, well, next up we've got cerebrovascular disease. Essentially, this means there are problems with blood flow in the brain, things like strokes or hemorrhages.
Exactly. They're not as common in animals as they are in people, but they do happen.
And the clinical signs can range from mild to severe, depending on, where the damage is and how extensive it is.
Right. You could see anything from very subtle neurological problems to coma and even death. It really depends.
So the chapter emphasizes, once again, the importance of MRI for diagnosis, with figure 218 actually showing an example of a cerebrovascular event.
Yep. MRI really helps you differentiate between what we call ischemic strokes, which is where there's a blockage of blood flow, and hemorrhagic strokes, which is when there's actual bleeding in the brain. That distinction is really important for determining treatment and prognosis.
Now let's talk about something that can be incredibly scary: hypoxia and anoxia. Essentially, this is a lack of oxygen to the brain, and this can happen for all sorts of reasons, right?
Oh, definitely. Everything from breathing problems to heart failure to near drowning. And the chapter makes it very clear early oxygen therapy is absolutely crucial.
So you got to move fast to try and prevent irreversible brain damage.
Exactly.
Okay, so before we jump into the rarer causes of stupor and coma, let's take a quick break. We'll be back in a flash to cover the rest of this neurology marathon.
Sounds good. Okay, so we've touched on some of those big name causes of stupor and coma, but this chapter, it doesn't stop there. It goes into all the diagnostic tools and techniques that you'll need to master as a future vet.
So, okay, say you're faced with a patient, they're showing neurological signs. Where do you even begin?
Well, the history is always your first and most powerful tool. It's like being a detective, gathering clues from the owner to figure out what might be going on.
So what kind of questions are we asking here?
Figure 2.4, it actually lays out some of the key questions. Are the signs acute or chronic? Any possible trauma? Toxins? Medications? You really want to get a clear timeline of the animal's behavior and any potential triggers.
And it's not just about the neurological symptoms themselves, right? You'd also ask about, appetite, vomiting, diarrhea, any changes in urination or drinking, those kinds of things.
Oh, absolutely. All those systemic signs, they can be just as important because they might point to an underlying cause for those neurological issues.
Gotcha. So you've got your history. What's next?
Well, then it's on to the physical exam. This is where you get hands-on and look for any abnormalities that could give you more clues.
The chapter really stresses paying close attention to any evidence of multisystemic disease. Things like fever, icterus, enlarged lymph nodes, anything out of the ordinary, really.
Exactly. Those seemingly small details, they can be incredibly important for guiding your diagnosis. So once you've got the history and your physical exam findings, it's time to move on to some diagnostic tests.
Okay, let's talk lab work. What are we running?
Well, we always start with the basics, a CBC, a complete blood count, and a serum chemistry profile. Those give you a snapshot of the patient's overall health.
Yeah, those are like the cornerstones of diagnostics.
Mm-hmm.
And your analysis can also be super helpful, right? Especially in cases of hepatic encephalopathy or ethylene glycol intoxication.
Right. Remember those calcium oxalate monohydrate crystals we talked about earlier? A urinalysis can help you spot them, which is like a key diagnostic clue for ethylene glycol poisoning.
It's amazing how much info you can get from a little bit of pee.
It really is. And then, if we're suspecting intoxication, you can also run specific assays for certain toxins. And the chapter also mentions checking for fungal elements in the urine, because aspergillus can sometimes be a factor in these neurological cases.
Wow, so many potential culprits. It's like a real detective game.
Oh, it definitely is. And then, depending on the case, you might also consider things like fasting and 2-hour postprandial serum bile acids, or a blood ammonia level. Those can help assess liver function, and an ACTH stimulation test if you suspect hypoadrenocorticism. Just depends.
All right, this is starting to feel very vet school now. But what about those cases where you need even more information?
That's when you bring in the imaging.
Ah, the big guns.
Yep. The chapter goes through all the different imaging tools we use in neurology.
So we're talking x-rays, ultrasound, CT scans, MRI, the whole shebang.
Pretty much. You start with basic radiographs of the chest and abdomen. Those can help rule out some problems and assess organ size. Then you might move on to ultrasound, which can be good for visualizing the liver and pancreas.
And there's that special type of ultrasound, right? Transcolonic scintigraphy for diagnosing portosystemic shunts.
Yep, that's the one. It basically helps you see how the blood is flowing through the liver.
Okay, but when you really need to see what's going on in the brain, you got to go for the gold standard, CT and MRI.
Absolutely. Those advanced imaging techniques, they allow you to see inside the skull and identify all sorts of things. Hydrocephalus, mass lesions, any inflammation, edema, hemorrhage. It's incredible.
It's like having X-ray vision for the brain.
It is. But then the chapter also talks about CSF analysis. You know, that cerebrospinal fluid we mentioned before?
Right. Why is that so important?
Well, CSF bathes the brain and spinal cord, so if we analyze it, we can get a lot of info about what's happening in the central nervous system. It's especially helpful for diagnosing meningoencephalitis.
So if you see a ton of white blood cells in the CSF, that means there's inflammation.
Exactly. It helps us distinguish between infectious causes and non-infectious causes.
That's so cool.
Yeah.
And the chapter even explains how to collect CSF,
Yeah.
from the cerebellum medullary cistern safely, even if the patient has increased intracranial pressure.
It's a delicate procedure,
Right.
but super important for getting the information we need.
All right, so we've got our history, our exam findings, and our diagnostic results. Now let's revisit some of those specific conditions we were talking about earlier. Let's start with head trauma.
Yeah, remember those images of brain herniation? They're a good reminder that head trauma is really serious. And Table 2.1, it's like that life-saving checklist for managing those cases.
Right, secure the airway, provide oxygen, control that intracranial pressure. Don't forget to monitor those vitals.
And it's important to remember that even what seems like a minor head injury can actually have some pretty serious consequences.
Yeah, it's not always obvious from the outside. Now, the chapter also mentions that different breathing patterns can be associated with lesions in different parts of the brain. What does that mean exactly?
So, for example, Cheyne-Stokes respiration, where the breathing alternates between deep breaths and periods of no breathing, that can suggest a cerebral or diencephalon lesion, while shallow or irregular breathing might point towards a problem in the pons and medulla.
So even the way an animal breathes can give you clues about what's happening in their brain.
It can. It just goes to show how important a thorough neurological exam is. Okay, let's move on to intoxication. Again, the chapter emphasizes how important it is to get a really detailed history. You want to find out if they could have been exposed to any potential toxins.
And Table 2.3, it's like a whole encyclopedia of potential culprits. There are so many things on there, from medications and pesticides to household cleaners and illegal drugs. It's a reminder that, animals can get into all sorts of trouble.
That they can. Okay, now let's focus on ivermectin and ethylene glycol specifically. Remember, ivermectin can be really dangerous to certain breeds, like collies.
Right, even small amounts can cause those serious signs.
And when it comes to treating ivermectin toxicity, it's mainly supportive care, managing the symptoms and preventing any more absorption of the drug.
Okay. And what about ethylene glycol? What's the key to managing that one?
Early diagnosis is key. Remember those calcium oxalate monohydrate crystals in the urine? That's your big red flag.
So if you see those crystals, you got to act fast.
Absolutely. Treatment with ethanol or 4-methylpyrazole, it needs to be started right away to prevent the ethylene glycol from being metabolized into those toxic byproducts.
And if the animal already has kidney failure, dialysis might be necessary.
Right. It can be a really serious situation if it's not caught early.
The chapter also covers lead poisoning, which can happen from, ingesting lead-based paint, putty, linoleum, even ficking weights.
Yeah, it's a reminder that toxins can be lurking in some pretty unexpected places.
Definitely.
And treatment involves removing the source of the lead and chelation therapy. That helps to bind and remove the lead from the body.
All right, let's move on to hypoglycemia, which we know can be a real emergency. The brain needs glucose.
It does. And when blood sugar levels drop too low, all those neurological problems can start to pop up.
We talked about how 50% dextrose is the go-to treatment, but the chapter also dives into those potential causes of hypoglycemia, like insulin overdose or insulinomas.
Right. It's important to figure out why that blood sugar is so low. And if an insulinoma is diagnosed, removing it surgically is often the best long-term option.
Makes sense. Okay, let's tackle hepatic encephalopathy again. We know it's caused by liver dysfunction, but the chapter goes into a lot of detail about the specific types of liver diseases that can cause it.
Right. We talked about those congenital porous systemic shunts, the PSS, in young dogs, but there are also all those acquired liver diseases that can cause problems, things like chronic hepatitis or liver tumors.
And treatment for hepatic encephalopathy focuses on, managing that underlying liver disease and reducing ammonia levels in the blood.
Right. Exactly. We often use medications like lactulose to help reduce ammonia production in the gut. And if it's a PSS, then surgical correction is usually recommended.
Okay, on to meningoencephalitis, which is inflammation of the brain and its coverings. We talked about how important that CSF analysis is for diagnosing it, but can you tell us more about the different types?
Sure. Remember, it can be caused by infections, bacteria, viruses, fungi, or it can be non-infectious, like those immune-mediated diseases we talked about. And each type will have a slightly different presentation and different treatment.
So, for example, if you see a bunch of neutrophils in that CSF, that suggests a bacterial infection.
Exactly. Or, if it's a viral infection, you might see more lymphocytes. The type of white blood cells we see helps us narrow down the possibilities.
That makes sense. And there's also a table in this chapter. It outlines the treatment options for meningoencephalitis when the cause is unknown, which is really helpful, I imagine.
It is. It gives you a starting point for those cases where you haven't quite figured out what's causing the inflammation. Okay, let's move on to hydrocephalus, that buildup of fluid in the brain.
Right. We talked about how it can be congenital or acquired, and that prednisone or surgery might be needed.
Yeah.
And the chapter also goes into the clinical signs associated with hydrocephalus.
Yeah, it can present in so many different ways. Dementia, seizures, head tilt, abnormal gait, even blindness. It really depends on how severe it is and where the fluid buildup is.
Wow, it really is a diverse condition.
It can be. And that's why imaging is so important. Helps us diagnose it and figure out the best way to treat it.
Makes sense.
Hmm.
Okay, on to neoplasia, brain tumors. We know they can cause all kinds of problems, but the chapter actually breaks down the different types that vets might encounter.
Right. They can originate in the brain itself, what we call primary brain tumors, or they can spread from somewhere else in the body, which are metastatic brain tumors.
And the clinical signs often depend on, like, the size of the tumor and where it is in the brain.
Exactly. A tumor in the cerebellum might cause ataxia, for instance, while a tumor in the cerebrum could cause seizures or behavioral changes. It all depends.
It's like detective work again, connecting those dots between the lesion and the symptoms.
It is. Okay, let's move on to cerebrovascular disorders, strokes, and hemorrhages.
Those are the ones where blood flow to the brain gets disrupted, right?
That's right.
And the chapter mentions that the clinical signs, they can vary a lot from mild to severe.
They can. A small stroke might only cause some subtle problems, but a big hemorrhage can be devastating, potentially leading to coma or even death.
And diagnosis usually involves an MRI to pinpoint where the damage is.
Yep. And the MRI helps differentiate between ischemic strokes, where there's a blockage, and hemorrhagic strokes, where there's bleeding.
Yeah.
That distinction is really important for deciding on the right treatment.
Okay, let's revisit hypoxia and anoxia, that lack of oxygen to the brain.
Yeah.
We talked about how oxygen therapy is crucial, but can you elaborate on what causes it?
Sure. Hypoxia, that's when there's not enough oxygen getting to the blood. It can happen because of all kinds of respiratory problems like pneumonia or asthma. Anoxia, though, that's a complete lack of oxygen. It can happen during cardiac arrest, drowning, or choking.
So it's all about identifying the cause and getting oxygen to the brain as quickly as possible.
Exactly. Okay, let's talk about cognitive dysfunction syndrome, or CDS. It's often described as a type of dementia in dogs.
Yeah, it's heartbreaking to see those once sharp dogs start to decline mentally as they get older.
It is, and the chapter, it outlines those classic clinical signs of CDS, disorientation, changes in their sleep-wake cycle, changes in how they interact with their family, house soiling, anxiety. It's almost like they're losing their cognitive abilities.
So what can we do to help these dogs and their families?
Well, the first step is recognizing those signs and getting a diagnosis. There isn't a single test for CDS, so it's often a diagnosis of exclusion. You rule out other possible causes for those behavioral changes.
You'd want to make sure it wasn't like a thyroid problem.
Yeah.
Or a brain tumor.
Exactly. Then, once you've ruled out other things, you can focus on managing the CDS and improving their quality of life.
The chapter mentions a medication, selegiline. I've heard that can be helpful. How does that work?
Selegiline helps to increase dopamine levels in the brain. And dopamine, that's a neurotransmitter involved in cognitive function. So boosting its levels can potentially help with things like memory and attention.
So like giving the brain a little boost.
Yeah, you could think of it that way. And there's also a nutritional supplement, same, that's sometimes used for dogs with CDS.
Same. That stands for S-adenosyl L-methionine, right?
You got it. Bit of a mouthful. But basically, same is thought to protect those brain cells from damage and maybe even help improve cognitive function.
Okay, so we've got medications and supplements. But what about behavioral things? Can those help too?
Oh, absolutely. Behavioral modification can be incredibly helpful for dogs with CDS. The key is to give them a consistent routine, a predictable environment, and lots of mental and physical enrichment.
So things like, having a regular feeding schedule, walking schedule, giving them puzzle toys, interactive games, making sure they have a comfy, safe place to relax.
All of that. It can really help reduce their anxiety and confusion, making them feel more secure.
The chapter also mentions those pheromone diffusers. I've heard those can be good for anxious dogs. Could they help dogs with CDS too?
They could. Pheromones are those chemicals animals release to communicate. And there are synthetic pheromone products that mimic the calming ones mother dogs release to their puppies.
So it's kind of like creating a sense of comfort and security.
Exactly. And for dogs with CDS who are often anxious and disoriented, that little bit of extra comfort can go a long way.
It's all about making those golden years as happy and comfortable as possible.
It is. And even though there's no cure for CDS, there are things we can do to help them live fulfilling lives. With the right medical management, behavioral changes, and lots of love and patience, we can help make this transition easier.
That's such an important message. And it's a reminder that as vets, we're not just treating diseases, we're caring for the whole patient and their family.
I couldn't agree more.
Okay, well, we've covered a lot of ground in this deep dive. Dementia, stupor, coma, CDS, so many conditions that can affect our furry friends.
It's been a wild ride through the brain. Hopefully everyone listening is feeling a bit more neurology savvy now.
We tried to break down some pretty tough topics and hopefully inspired some folks to keep learning about this fascinating field.
I hope so. Neurology can seem intimidating at first, but it's so rewarding. The more we know, the better we can help our patients.
That's the crux of the matter. Any last words of wisdom for those future vets out there?
Don't ever be afraid to ask questions, seek out mentors, and challenge yourselves. Vet neurology is constantly evolving, so there's always something new to learn.
Well said. And remember, everyone, from Vet Neurojar, keep those minds inspired, hearts light, and tails wagging. All right, so we're back and ready to tackle cognitive dysfunction syndrome, CDS. It's a topic that hits close to home for a lot of pet owners. And vets, too, I'm sure.
It really does. It's essentially like dementia in dogs. And it can be so hard to watch those, once energetic and bright companions start to decline mentally.
Yeah, the chapter does a good job of describing what CDS actually looks like in dogs. Disorientation, changes in their sleep, changes in how they interact with their family, house soiling, getting lost in places they know well. It's almost like their internal compass is broken.
It is. Imagine a dog who used to greet you at the door, all excited, tail wagging, and now they just seem confused, withdrawn, or a dog who is totally house-trained and now they're having accidents. It can be really tough for everyone involved.
For sure. And while it's, a natural part of aging for some dogs, that doesn't make it any easier to deal with. So what can we do to help these dogs and their families?
Well, recognizing those signs is the first step. And getting a diagnosis. There isn't one specific test for CDS, so it's often a diagnosis of exclusion. You rule out other things that could be causing the changes in behavior.
So you want to make sure it's not something like a thyroid problem or, even a brain tumor.
Exactly. Once you've ruled those things out, then you can focus on managing the CDS and trying to improve their quality of life.
The chapter mentions a medication called salicyline. I think I've heard of that one. How does it work?
It helps to increase dopamine levels in the brain. And dopamine is a neurotransmitter that plays a role in cognitive function. So by boosting its levels, you can potentially improve things like memory and attention.
So, it's kind of giving the brain a little boost.
You could think of it that way. And then there's also a nutritional supplement, SAMe, that's sometimes used.
SAMe. That stands for, what is it, S-adenosyl L-methionine?
Yep, that's the one. Bit of a mouthful. But SAMe is thought to help protect brain cells from damage and maybe even improve cognitive function.
Okay, so we've got medications, supplements. But what about behavioral things? Can we do anything there?
Oh, absolutely. Behavioral modification can be really helpful for dogs with CDS. I think the key is to provide a consistent routine, a predictable environment, and plenty of mental and physical enrichment.
So things like establishing a regular feeding schedule, walking schedule, giving them puzzle toys, interactive games, making sure they have a comfortable place to just relax and chill.
All of that. It can help reduce their anxiety and confusion, which makes them feel more secure.
The chapter also mentions using pheromone diffusers. I've heard those can be helpful for, anxious dogs in general. Could they help with CDS, too?
Potentially. Pheromones are those chemicals animals release to communicate. And there are products out there that mimic the calming pheromones that mother dogs release to their puppies.
So it's like creating that feeling of comfort and security.
Exactly. And for dogs with CDS, who are often anxious and disoriented, that can make a real difference.
It's all about making those golden years as happy and comfortable as possible.
Absolutely. And even though there isn't a cure for CDS, we can still do things to help them live fulfilling lives. With the right medical management, some behavioral changes, and a whole lot of love and patience, we can help make this transition a little bit easier.
That's a great message to end on. And it's a good reminder that as vets, we're not just treating diseases, we're caring for the whole patient and their family.
Couldn't agree more.
Well, I think we've covered a ton of information in this deep dive. Dementia, stupor, coma, CDS, so many neurological conditions that can affect our furry friends.
It's been quite the journey through the brain. Hopefully our listeners are feeling more confident about these complex topics.
I think we did a good job of, breaking things down. And hopefully we inspired some people to keep learning more about this fascinating field.
For sure, neurology can seem scary at first, but it's also so rewarding. The more we learn, the better we can help our patients.
That's the burning question. Any parting words of wisdom for our future vets out there?
Don't ever be afraid to ask questions. Find good mentors. Challenge yourselves. Veterinary neurology is constantly evolving, so there's always something new to learn.
Well said. And remember, everyone, from Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.